In just 3 weeks, Ohio Health Grady Memorial Hospital's maternal unit is scheduled to close.
Now, the decision will eliminate 37 jobs, and it really has sparked weeks of pushback from nurses, patients, and local leaders. 10 TV's Libby Cathy has been covering this story from the start, and she spoke with people fighting to keep this unit open. Libby, let's talk about it. What's the latest here?
Well, Yolanda, Jeff, earlier today, more than 100 people gathered rallying for this hospital in Delaware County, urging the Attorney General to step in and stop the closure of this maternal unit. And tonight, the Attorney General's office behind me tells me that they are reviewing this concern.
More safe maternity units are essential, not less.
For Delaware mom Monica DeToda, this fight is personal.
Because my son, Nick, was born at Grady Memorial Hospital during an emergency that showed our family just how important access to maternity care can be. Local maternity care.
She says without Grady, her story could have ended differently.
Delivering at home, delivering in the back of an ambulance, delivering on the side of 23 while trying to make it to Riverside.
And now she fears other families will soon face that possibility.
Childbirth is such a sacred experience. It's more than just giving birth in a hospital, it's giving birth in a place where you feel safe.
That's why dozens rallied outside the hospital on Thursday, hoping to stop Delaware County's only labor and delivery unit from closing.
Making babies arrive in ambulances instead of delivery rooms doesn't make sense.
The Ohio Nurses Association says Ohio Health promised to keep maternity care at Grady and wants the Attorney General to decide whether it can legally close the unit.
This is bigger than Grady. If healthcare corporations can make promises to acquire community hospitals and then later break those promises without consequences, every community hospital in Ohio is at risk.
Ohio Health says the decision is based on patient care, noting deliveries at Grady have dropped 23% since 2019. The health system also says it continues to honor the spirit of the 2005 operating agreement. Still, those here concerned that as Central Ohio grows, maternity care is shrinking, forcing mothers in Delaware County and beyond to travel further for care when minutes matter.
We're trying to prevent another maternity care desert in Ohio from being created.
And now, while this event tonight was put on by the Ohio Nurses Association, Democratic candidate for governor Amy Acton also did speak at the event. And I also want to note, when it comes to this operating agreement currently under the Attorney General's review, Ohio Health highlights how one of the parties they entered into this agreement with, the Healthcare Foundation of Delaware County, has since dissolved. Reporting live outside the Attorney General's office, Libby Cathy, 10 TV News.